I am super excited to sit down with my next guest. It's been a couple of years since they have held their annual user conference, and so I'm excited to sit down and catch up with him to see if he's made progress on the promises he made 2 years ago. And more importantly, I wanted to ask him about some of the pretty bold statements that he made in his opening keynote. Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting stories from the world of health IT. I'm Colin Hung, and I am here in Arlington, Texas at the Greenway Health User Conference, also known as Reengage 2. I am here and I'm going to sit down with Pratap Sarkar, who is the CEO of Greenway Health. He and I are going to talk about some of those bold statements that he made in his opening keynote to kick off this fantastic event. Let's get to it. Pratap, welcome back to the program.
Thank you very much, and thank you for participating in our client event. As you know, we kicked it off yesterday, and there's a tremendous amount of excitement amongst all the participants, and we're looking forward to not just the remainder of the day and the wrap up tomorrow.
Yeah, no, this is thank you for the invitation to come down here. It's beautiful down here in Arlington, Texas. And yeah, let's start there, because yesterday you were on stage to kick things off, very exciting set of announcements. And you made a few bold statements, I felt, on the stage there, and I wanted to dive into them with you. So, but before we go there, maybe just for the benefit of our audience that maybe isn't as familiar, can you give me the quick overview of Greenway?
Absolutely. So, Greenway has been in the healthcare IT market for several decades. If you look at different forms of Greenway, it's frankly an amalgamation of companies that have been acquired and merged together over the past 30 or 40 years. And what we are today is we provide healthcare IT solutions, practice management, EHR, revenue services, patient engagement, and a host of other solutions to the ambulatory space in the US. There are 10 specialties that we are extremely strong in, and our sweet spot is clients who have between 11 to 75 providers. And of course, things that we do for those clients have a positive impact on clients that are larger than that, as well as clients that are smaller than that. So we've been around for a while, and a fairly well-known brand and entity amongst our current users, and are probably at that pivotal point as an organization where we're making a dramatic change and are going to come back in a really, really big way. I'll just make one last point. The last time you interviewed me was during a previous client event, which was approximately 2 years back. Mm-hmm. And at that point in time, a lot of my focus was on improving uptime, stabilizing our products, adding more and more functionality. But there's been a significant pivot from where we were then, because a lot of the heavy lifting has been done. And we feel very confident that not only are we back, we're going to go aggressively after our competitive footprints, while at the same time making sure that we are providing the best solutions to our current customers to become the most respected EHR in the industry, which is again what I shared in the presentation yesterday.
I was going to say, like, that was one of the bold statements you made yesterday about being a little bit more aggressive on the marketplace. Yeah. Because Greenway, I think when I first sat down with you in 2022, it hadn't really been as aggressive in the market, and now to hear you say, watch out, yeah, you're really getting out there. I'm sure it's very encouraging for your clients and for your own team to hear that.
It is, and just on that point, because it's a super critical point. I can tell you without an iota of doubt that our net promoter scores have been consistently going up over the past several years, and your clients tell you more than what anyone else can tell you, your analysts or your own employees, and so on and so forth. And when they come and tell you that we've kept our word in terms of what we've done over the last couple of years, and B, when they have a fresh set of demands or asks, you know that you're moving the right direction, right? And your clients are willing to move with you. So that's very clearly positive. The analyst community has been very positive on Greenway as well. But to me, one of the biggest anecdotes of success that I'd like to share with you is, over the last 5 years, particularly when we were under the corporate integrity agreement, And we had to spend a lot of time and effort in essentially making sure that the company was 100% compliant in everything it did. And I'm proud to say that we are probably the most compliant EHR software in the industry today. But during that period, we had a lot of our employees exit the organization. And these were some of our best employees. The thing that gives me a tremendous amount of satisfaction is over the last 12 months, a lot of those employees are coming back. And these are employees across different functions. You have people in the product and technology organization who are coming back. You have people in the revenue services division who are coming back. And salespeople are coming back. And the last one is important because salespeople don't come back till they know that they're going to succeed. And especially when you have your best salespeople, right? So it does feel like our sales are picking up the wind. And we're going to accelerate in a manner that I've always wanted to since I joined the company, and we're seeing it happen right now.
But on that theme of being more aggressive, one of the statements you made yesterday was being more aggressive in terms of the features that you're going to be rolling out. You've done a lot of work between the last time we spoke and now, but it sounds like you're going to get even more aggressive on that. Tell me more about that.
100%. And there are several things that are playing out in Greenway almost as we speak. The first thing I will tell you is when I actually look at the suite of services and products that we have today, we are actually making practices become autonomous in the way they operate and be completely automated, by leveraging Gen AI and so on and so forth, right? That positioning is important because that drives how we are going to be viewed or how we expect to be viewed by our clients and by our prospects as being a company that solves problems versus being a company that has a menu of products for you to select from, right? And one of the statements that I had also made is that I view Greenway as a company that's going to be powered by AI, but driven by our core purpose and values. And our core purpose is around making sure that our providers are successful, making sure that their patients are empowered and engaged, and thereby leading to healthier communities. So now if I take that and I pivot back to what's happening with generative AI and how we are leveraging generative AI, firstly, Colin, I've been in this industry for a while, and people have been talking about AI for more than 2.5 decades right now. There have been things that have worked, but mostly there have been clients, vendors, partners have found it difficult to really apply AI in meaningful ways to their day-to-day lives. There's no doubt in my mind that this time is different. And what we've done at Greenway is we are actually using generative AI as a way to leapfrog not just ourselves, but to leapfrog our competitors in terms of how we integrate AI in everything that we do. And I spoke yesterday about the two aspects of how we are leveraging AI. One is the AI-powered Greenway. Every software engineer at Greenway leverages an AI toolset that we've made mandatory since the beginning of this year. We are rolling out Microsoft Copilot across the entire organization to drive and increasing efficiency within our own staff. There are a whole bunch of other things that we are doing to make sure that we have the right tools and the right mentality and the right leadership, the leadership behind getting this done. And in the last 6 months, we've seen productivity improvements as high as 20% in just our internal workforce. Now, when I take that to our clients in terms of our products and services, there are several feature functionality that we've launched recently, say for instance on the patient engagement side or in the ambient voice side, which is powered by Gen AI. The next big phase is how do we take critical workflows, as an example, an e-prescribing workflow, completely reimagine the workflow and do so by integrating Gen AI in every aspect of that workflow. There's one more important milestone that I want to share with you is we have a very robust partnership with AWS HealthLake. And approximately a month back, we essentially have all our clinical data in a completely secure and segmented manner, segmented by client, of course, in AWS HealthLake. So that fundamental move of taking all our data and essentially putting it in AWS HealthLake now gives us the ability to use it as a staging ground to ingest that data into a large language model. And frankly, at that point in time, the limiting factor is our imagination. And one of the things that we've recently launched to our internal support teams, and this is then going to go out to our clients, if we've launched our own version of, I call it our own version of ChatGPT. We've essentially taken all the documentation that exists on all our products and all our services created over the last 30 years, including documentation that exists within our code, have ingested into Anthropic's Claude, and have essentially created a prompt interface which gives you advanced and summarized help to complex queries. Our support teams are using it right now, and my intent is that over the next 3 to 4 months, I'll have this with our clients so that they become much more conversant in not just using our platforms, but using it in the right manner. So to net it all off, I know I threw a lot at you. There's a tremendous amount of work, effort, and action that's taking place in Greenway. And I believe the combination of Gen AI, the roadmaps that we've laid out, is going to dramatically change how we operate as a company.
So let's go there for a little bit.
Yeah.
You yesterday said, and you just mentioned, everything that Greenway is going to be doing, any innovation that you're coming up with, is going to be AI, based on AI. If we fast forward a little bit, what does that mean for your clients? Like, what is all this Gen AI going to mean for them in a few years? Like, I know we're not going to get to the completely automated practice, but how far are we going to make it in your mind?
Absolutely. So let me talk about what they can do right now, right? And I'll start with the clinician because that's probably where there is the most friction today when practices operate.
Sure.
Ambient voice. It's real today, right? We within Greenway, within the executive leadership team in Greenway, we use ambient voice solutions to not just record our meetings, but most importantly, to summarize our meetings so that we have an ongoing record of what was discussed, what were their action items, and so on and so forth. The ambient voice solutions that are available in the market today do exactly that. And when you have an integrated Gen AI-driven ambient voice solution, it's like you're the patient and I'm the doctor. You're essentially having this interaction, rather than the physician having to spend at least 20 minutes, go back and write his notes and make sure everything is right.
Sure.
Like 80% of that work is done. Maybe 90% of that work is done. That is available today. Our clients are using it. We've launched a solution in partnership with Nabla, and I'm super excited about what's happening out there. Patient engagement, right? Gen AI can be used in scheduling. Scheduling is one aspect of patient engagement that takes a fair bit of time, scheduling, rescheduling, and so on and so forth. The other area is interaction with your patients. So say, for instance, you have a patient who is not an English-speaking patient, and you want to converse with them, using text messages or using emails. The power of the technology is such that I can send my messages in English and they be translated into Spanish and vice versa, right? Gen AI allows a lot of that to be frictionless. So these things are available today. The other experiment that we are running with is on the Greenway Revenue Services side. And I think revenue services represents a massive opportunity because revenue services processes are very systematic. And we intend to, we intend to roll out things like, insurance follow-up, automated payment postings and coding and so on and so forth. That one is going to happen. I'm so confident that one's going to happen is that I don't want to talk much about it, right? But when I mentioned about moving all our data to AWS HealthLake, clinical decision support, which has been a little bit of the holy grail and everyone talks about it, can now become real because I can use all that data and provide very precise, diagnostics or guidance at the patient level, frankly, using data that exists in that large language model and data that I ingest from other sources. And in terms of a timeline, that's less than 6 months away. So I can start off by helping clinicians create a pre-chart. and then perhaps go beyond that in terms of getting more insights through all the data that is gathered and the Gen AI tools. And then at some point in time, there is no reason why it can't be formally shared with patients. As an example, Colin, I was sort of sharing with the audience yesterday that I have probably 3 or 4 paid subscriptions to Gen AI tools on my phone. And I pay for the subscriptions because I'm really, really serious about that. I have run experiments on myself and my medical records by just uploading it into Perplexity or ChatGPT or all the other tools that are available out there, just to see how good they are. And I'm pleasantly surprised.
Okay.
And I don't have access to all my clinical data, but now just imagine a situation where the data now exists. Then it's a question of what you really do with the data. So I think this is super, super exciting in more ways than one. You can probably sense that in.
Yeah, you're clearly excited.
Yeah,
and I have to say, for the audience, not recommended to use what you just talked about on the free versions.
Yeah.
You went with the paid versions to upload your medical record.
I did use the free versions for a few weeks.
For sure.
But then I realized I was not necessarily getting the best outcomes, or was not necessarily being prioritized in the time required for the responses. And at Greenway Health, and my team knows this, I use it to summarize presentations, I use it to summarize worksheets. They have hallucinations every now and then, but I'm just amazed at the power of this particular technology. And I think there are ways to apply it in our business to actually serve our patients, our providers, and our communities.
But it sounds like, if I can summarize what you just said, like the AI that you're deploying within Greenway, it sounds like it's really meant to remove the unnecessary bits from the practice of medicine, right?
100%.
It's all the administrative stuff, it's the RCM side,
100%.
and automating those, but still keeping the doc in the control seat, right?
100%.
And AI is more like the co-pilot.
100%, and that's an excellent point, and there are different variants to that point. Firstly, I don't believe that we are at that stage where any AI technology will completely replace, or in the context of healthcare, should replace what the clinician does. I think this will be a significantly augmentative, if I can use that term, technology, which will help providers not just reduce their workload, but become much more efficient in managing their clients and serving the needs of the communities in which they operate. The same would apply to AI-powered Greenway. We're not using AI from the perspective of let it replace the people who are doing what they're doing today. It's to hypercharge them from a productivity standpoint. So in some of the experiments that we've conducted in Greenway, when we've armed each one of the engineers with a cohort of tools, the 20% productivity improvement, I'm not going back and saying that, hey, I need you to take out 20% of cost. What I'm going back and telling my engineering teams is that list that you have from our clients on what they should solve for, burn through that faster for me now. So keep that entire 20%. I'm not taking this away from you. Burn through that faster. And not only are they doing that, they're doing so with better quality, right? Versus spending hours and hours, in writing test scripts and writing lines of code which don't necessarily do much but are required to be written because that's how programming works. It's been phenomenal. I mean, the smile is back on the faces of programmers, and programmers don't smile much, right? So you can just imagine the excitement that it is creating even within the organization.
And I switch gears on you because you made another statement yesterday that I found super interesting. The one thing that's keeping you up at night, cybersecurity.
Yeah.
Tell me more about that. Tell me what you're kind of working on as Greenway as you address that concern.
Yeah, not only is it keeping me up at night, but when you read of an incident that's happening to another player, could be in healthcare, could be a competitor, or frankly could be in any other industry segment, I have to tell you my heart skips a beat, because this is no different than someone raiding your house and you can do nothing about it, right? You can have all the protections in place, but the question I keep asking myself and keep asking my Chief Information Security Officer, that we have to get out of this mentality of it's going to happen, It's a question of when. We have to make sure that we are a step ahead of the perpetrators of cybercrime, so that we protect ourselves and protect our data and all of that stuff. I think the best example of why that keeps me awake at night is what happened with Change Healthcare. In this particular instance, they did not necessarily have multi-factor authentication in place. One would assume that that's a fairly basic thing, but you still need to have it in place. All I can tell you is the way we are approaching this particular problem is, my first philosophy is someone can break in. So what do we need to do to prevent that from happening, or to limit that possibility so that it does not happen? So over the last 3 years, there hasn't been a single year where I've not significantly increased my cybersecurity spend. That's point number one. We've hired some extremely competent people from the outside who are part in our cybersecurity team. And in our case, in Greenway's case, because we are part of the Vista portfolio of companies, Vista has some incredibly robust principles in place in what you should do as a software company. I mean, they have close to 90 companies in their portfolio, to protect yourselves in the best manner possible. And we are literally implementing each one of those, and have implemented several of those already without taking our eye off the ball. In my opinion, this investment will continue. I would even go to the extent of saying that in some instances, I prioritize investments in cybersecurity more than I prioritize investments in the product. Because if our environment is compromised, it really doesn't matter what you're doing with the product, right? So it's the reality of the world we live in today, unfortunately. And I genuinely wish more was being done in this particular area, at a state level and so on and so forth. But it's the reality of the world we live in, and we just have to be smart about it.
Well, and I think you hit on something. One of the lessons that I'm hoping we take from the Change, which, by the way, could have happened to anybody.
Could happen to anybody,
right?
yeah.
Not just singling out Change, but it's that prevention is one side, but recovery is another, right?
100%.
I think what we can forgive is, criminals are smart. There's lots of tools coming out very, very often, and keeping up with that. You should try, but we're always going to be a step behind because we're not as motivated as they are.
Correct.
But it's the recovery side that we can control, so that if it does happen, we're not down for weeks and weeks. We can be back and running within a couple of days or a few hours, right?
Correct.
And so it sounds like are you investing on that side as well?
100% we are. And the other thing I spoke about is, across the organization, be it internal or external with our clients, we've made a fundamental decision that we're going to be 100% in the cloud in everything that we do. There are several reasons why that makes tremendous sense, but cybersecurity is one of them. The fact of the matter is, the big three cloud providers, we're going through a selection process right now, but the big three cloud providers have resources, money, and clout to invest in cybersecurity in a manner that, frankly, most enterprises today do not have. So not only do we want to make sure that if something happens, there are ways to recover rapidly, but again, I go back to what I said earlier: prevent stuff from happening. For sure. And let's partner with the best out there, who have the ability and the technological wherewithal to keep us all secure. There's also one more aspect in cybersecurity, that we invest a fair amount in Greenway. In fact, I would say that we invest in this in Greenway more than we did in some of the previous organizations that I've worked in, and some of the previous organizations that I've worked for were Fortune 500 companies, Fortune 100 companies, is on employee education. So it's a little bit like, you might have the best security system on planet Earth, but if you leave the lock in your to your home open, someone could just walk in, right? So we spend a lot of time and effort in training our employees on how to watch out for the right signals. Some of it is very basic, don't click on city links and stuff like that. But then we track that meticulously as well, and have the ability of identifying which employees need more education, or the kind of simulated scams that employees are more likely to fall for. So I'm glad you asked me that question, because very often it does not get discussed till something happens. Right? And that mentality needs to change, even in organizations like ours and others in the healthcare IT space.
Pratap, final question for you. For those clients of yours and perhaps for those prospects who couldn't be here,
Yeah.
what message would you like to give to them?
It's what I said in wrapping up my presentation yesterday, that Greenway 2.0 is going to be powered by generative AI and driven by our core purpose and our values. Not only are we back, we are back in a very aggressive and strong way, and we're going to hit back, take back more share from the marketplace, and most importantly, create solutions which bring back the smile on the faces of our clients and the different constituents within our clients' practices. Clinicians, front office staff, back office staff, and so on and so forth. You walked around the whole place. I mean, I'm sure you picked up the confidence in our employees and in our clients. The next time we speak, hopefully I'll be able to share some results with you on that.
I look forward to that, Pratap. Well, thank you so much for being on our program and sharing all this great information.
Thank you very much. Great catching up with you again.
Always a pleasure. Always a pleasure. Hey, I want to thank Pratap for coming on camera with me and giving me that behind the scenes look at what's been happening here at Greenway Health over the past few years. And I was really impressed with the amount of energy, effort, and excitement, frankly, that he has got for improving cybersecurity. It's so needed, and I think his clients are definitely going to appreciate the amount of effort the organization is putting behind being secure and being able to recover quickly should a cybersecurity event occur. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.